That will be at 3:30. The first briefing will be tomorrow in Vancouver at Vancouver Cabinet Offices. And with that, I wanted to introduce Dr. Henry to lead to start today's briefing.
Thank you. Thank you. And I want to start off by letting you know that we unfortunately have had a death here in British Columbia. We are deeply saddened to hear that one of the residents of the Lynn Valley Care Home who was infected with COVID-19 passed away last night. And our heartfelt condolences go out to his family and loved ones, and also, of course, to the staff who provided him care and to his home at the Lynn Valley Care Centre. We also have a number of new cases, and I'll start with talking about what is going on at the Lynn Valley Care Centre. We're up to 32 confirmed cases here in British Columbia now. As you know, the Vancouver Coastal Health has been on site at the Lynn Valley Care Centre since we first became aware that the community case that we had was a healthcare worker who worked at that centre. It's now become apparent that there are other people at that centre who were ill, a number of residents, as we know. So far, 2 residents have tested positive. There's ongoing testing and ongoing monitoring of all of the residents at the facility. In addition, one additional healthcare worker has tested positive for COVID-19. She's a woman in her 40s who lives in the Fraser Health Authority area, and she is home in isolation right now. In addition, we have 2 new close contacts of case 21, our community case, a male in his teens and a male in his 50s, and they both reside in the Fraser Health region and are isolated at home, and both of their condition is also stable. Over the weekend as well, we've identified 2 additional imported cases into British Columbia, a female in her 50s who has returned from travel to Iran, and a male in his 30s who is our first imported case with a history of travel to Italy. Both of them are in the Vancouver Coastal Health region, and both, again, are isolated at home and doing well. I will also give an update on our other cases. So we still have 4 people who have recovered completely. We are awaiting testing on a number of others whose symptoms have resolved completely. But as you know, we are requiring people to have negative tests before we say that they are fully recovered from this. And a number of them have been tested regularly, but do not yet have 2 negative tests, at least 24 hours apart. So we are monitoring those. We have 3 people who remain in hospital, 2 people in the Fraser Health region, and they're both in stable condition, and 1 person who remains in the ICU at Vancouver General Hospital and is also in stable condition. A couple of things that have come up over the weekend that I do want to mention. One is there has been some letters gone to some schools in the Fraser Valley region, mostly to reassure people. There were people who were in those facilities who have tested positive for COVID-19. However, they were asymptomatic, which means we do not believe there is a risk to people who are using those facilities. The schools have been very proactive and did additional cleaning over the weekend to make sure that everybody is reassured that they're safe, and that we have processes in place in all of our schools now to enhance cleaning, to enhance measures for people to be able to clean their hands regularly, and we'll be monitoring those situations, of course, as these go on. We've also, today, the federal government has increased their travel advisory warning for people who are planning to go on cruise ships. We have had a number of people, as you know, who've returned to British Columbia who were on previous cruises, and so far 2 people have tested positive for this, and they're both people who are in hospital at the moment. So we are really pleased that the Canadian government has recognized the risk right now that traveling on cruise ships ships does give people, and we know that there's the Grand Princess off California. There's been some cruise ships in Egypt as well where there have been cases, and it's just an environment where people cannot separate from each other sufficiently to prevent transmission of respiratory viruses. And with the ongoing outbreak that we're having around the world now, there's really no way to effectively screen people out of cruise ships. And so it is really taking a chance on your health at the moment. I don't think this will last forever, but the federal government has upgraded it to a level 4 warning, which is to advise against going on cruises in the near future. The other thing that we have been getting a lot of questions about is about events and whether we should be cancelling community events. I talked a little bit on Saturday about some of these closer environments, indoor environments where people do gatherings, where people share meals, where people spend a lot of time together in closed environments. And I'm asking people to consider having alternatives to those types of environments right now, particularly if they're being attended by people who are elderly, who are more likely to have severe illness or complications from this virus. So we'll be talking some more about that, but to forego some of the things that we do sometimes in greetings, in hugs, kissing, shaking hands, and to try and put some distance between us, even in small events, in business meetings. Look at how we can do these things virtually. There is also a lot of risk assessment that goes into events, larger events that are happening. We had the Rugby Sevens on the weekend, and there were different measures that were put in place to ensure where the teams came from, to ensure there were provisions in place to separate people if we can, to make sure they could clean their hands regularly. And each of these large events is taken on a case-by-case basis, and we do a risk assessment about who's attending, what the environment is, how long it is, and all of those different measures. So that will be ongoing, and I know a number of events have been cancelled, and there's a variety of reasons for that, and public health is here to support people in those decision making. And finally, I wanted to bring up a disturbing thing that we've been made aware of, is that some people are calling people and offering them fraudulent laboratory testing for a cost. And we're telling everybody in British Columbia there is COVID-19 testing is done by our lab, which is an accredited lab. We are moving it out to several other labs around the province, but this is all done for free. Our turnaround time is very quick, and they do not and should not be asked for money and should not be paying people. So be aware that there is, for some reason, people trying to scam people around getting testing in this province. Thank you.
Thank you. And so thank you very much, Dr. Henry. This is obviously a very sad day for all of us, but especially, of course, for the family and loved ones of the man who passed away at the Lynn Valley Care Home. And our hearts go out to the family, to the care family, to all of the people who work at the Lynn Valley Care Home. This is obviously a very sad day for them, and indeed for all of us who are working on this question. Today, Dr. Henry has announced 5 new cases, which means the total of cases is up to 32. And the majority of those cases, 16, involve in some way travel to Iran. So half of the cases, 5 involve in some way travel to China, and obviously travel from other places. And then there's the significant issues that we see at the Lynn Valley Care Home. I wanted to say that what this shows is what was said on Friday in the detailed briefing we gave to reporters in the community, is that some people are very vulnerable. People with pre-existing medical conditions are more vulnerable than others. And obviously people who are older, over 80, are vulnerable. We saw in the evidence that was presented by Dr. Henry on Friday from Hubei province that somewhere over 14% was the mortality rate for people over 80 have COVID-19. So the situation for all of us and the responsibility for all of us is significant to not go out when we're sick, to not work when we're sick, to not go to school when we're sick, but also to not visit care homes, to not visit hospitals, and to not visit our friends and our family who are older if we're sick. And I think we wanted, of course, to reiterate that today. Dr. Henry has talked about some of the other issues, but we also want to continue to praise people who are providing care around the province and in all of the work they do. People involved in this matter, from Dr. Henry to the people at BC Centre for Disease Control to health authorities, people who work in care homes, are enormously committed to people, and we want to acknowledge today all of the work that they do and all of the work being done and the support they're getting from members of the community. On some of the broader policy questions, as you know, the federal government made its announcements around cruise ship. We wanted to both thank the federal government for increasing their warning to people about traveling on cruise ships and for their efforts to bring people home from the Grand Princess, Canadians home from the Grand Princess. Their determination to do that is much appreciated, and I think we need to acknowledge the extraordinary work done by federal officials on previous evacuations, in particular from Wuhan and from Tokyo. So with that, we're happy to take questions. As I said, we're going to do regular briefings at a regular time every day for the remainder of this week and into the future, from Monday to Friday, and on weekends if necessary. And those briefings this week will take place at 3:30 so that the public and all of you can plan for that. Thank you. And
so we're going to start with questions in Victoria and then go on to the phone. For those on the phone, please press star one to queue up. Les Lane first and then Vaughn.
Well, Doctor, if Canadians are advised not to get on cruise ships, should cruise ships be docking in Canada? And related to that, who makes the call on that question, which I'm sure is being discussed? Is it Dr. Tam or yourself?
So that is absolutely being discussed. We are very aware that the cruise ship season is coming up here in Victoria and Vancouver and on the East Coast as well. So there is active communications, and the call is really made by the federal government. It's Transport Canada, the Canadian Border Service Agency, but they do take advice from both myself and my counterpart in Nova Scotia, as well as Dr. Tam.
Do you have any advice for them, or have you offered it?
I have offered, certainly, my advice, and I know there's ongoing discussions. My personal belief right now is that we are in a very critical time around the world, and it is my belief that we should be delaying our cruise season until we are in a safer place internationally.
And last question on that. Do you have any indication of when they might make that call?
I expect it'll be coming, if not this week, but within the next, within the coming days, for sure. There's ongoing discussions, and it's a challenging thing. You know, we know that this will impact businesses, both here in Victoria. The tourist industry is being hard hit by this, but my primary concern is the health and safety of people in British Columbia, and I have grave concerns about boat cruises right now.
And you remember there's more than 200 people, Canadians, on the cruise ship currently off the coast of California. The government of Canada is taking this extraordinary step, as you can imagine, of essentially evacuating people who are asymptomatic to Trenton. And I think that's why the warning is important today, because we have time, and you'll see this week developments around the cruise season in Canada, which starts in April in the case of the West Coast, in any event. But obviously people are making decisions, and lots of Canadians go on cruises this time of year. We see this in the case of both the Diamond Princess and the Grand Princess. So that's why the communication today is really important for them, and for people to understand that this evacuation and the approach the government of Canada is taking to this evacuation, now that this warning has been given, may not continue to be the approach. So people have to take that information they're receiving from the government of Canada very seriously.
Over to Vaughn, then Keith, and then Binder, and then Mike. Vaughn?
The as the Wall Street Journal noted on the weekend, congratulations on getting a picture of that. It's a good story. We've done well here in British Columbia. Unfortunately, our neighbor just across the border hasn't done very well. Are we doing enough to deal with the risk of people traveling back and forth between Washington State and British Columbia, given that they really don't know? They haven't done what we've done in terms of identifying the risk and how far it may be spread in the community. We have a ferry that arrives here a couple of times a day from Washington State. We have border crossings. Are we doing enough? Could we do more? Should we do more?
Go
So
first.
I'll start by saying, even though, as you say, the testing has been behind in the United States, they are absolutely putting all gargantuan effort into identifying where people are in the community, particularly in Washington State. They have a very strong public health system. So I'm not concerned about the spread there in the same way as we have seen in places like Iran, for example. But it is clear that their strategy has been a challenging one in the U.S. And we do need, there's no way we could stop people going back and forth. There are many Canadians who live in Washington State, many people who have connections back and forth. We do need people to be aware and to know what to do, and we're doing that both in Washington State and here and across the country, both of our countries. Anybody who's traveled and who gets sick needs to really pay attention to staying away from others. That's the main thing that all of us can do, and to take those precautions that we need to take every day to prevent transmission of infections. And it wouldn't be a day gone by where I don't say, cleaning your hands regularly, covering your mouth, coughing into your sleeve, and staying away from others if you're sick. You may not have this virus, but we know there are other things that are causing people to be sick right now. So people need to know what to do, stay away from others. If it gets more serious and you need medical attention, or if there's some connection to COVID-19, then call ahead so that you can be assessed and tested if needed and cared for safely.
And this is just to note that I believe one of the most recent cases in Ontario came from travel from Colorado, for example. And really what it tells us is what we've been saying for some days, which is how deeply interconnected the world is. Both the links with Washington State, all of us, I think many British Columbians have been there hundreds and hundreds of times, some thousands of times, I would think. And so those links are profound, but they're also profound with Iran. And it's one of the reasons why we have to do what we need to do here in British Columbia, but we also have to support all other jurisdictions, because what happens in public health in Iran matters here, and what happens in public health in Korea matters here. And we've seen that. And we've also seen very strong healthcare systems, such as Japan, such as Korea, such as Italy, face very severe conditions and outbreaks. So we have to acknowledge that this is an interconnected world and do everything we can. And I think with respect to Washington State, we're working very closely. Dr. Henry in particular is working very closely, and we are at a government-to-government level to both support them and work with them. We've had so far, as you know, one case of travel from Seattle, and positive case of someone who lives in Seattle who was found positive in British Columbia. But people have to be conscious, because before we found the case in Iran, we didn't know there was an issue with Iran. And since then, we've had half of our cases in British Columbia involve travel to Iran in some ways, or connection to travel to Iran. So this is a fast evolving situation, and so the advice we give and the advice that Dr. Henry and medical professionals are giving is the advice that people need to follow.
Based on the numbers from the World Health Organization, I've seen estimates. It could be as many as 1 million cases worldwide in April. Based on the numbers in British Columbia, where could we be in a month in terms of number of cases?
It's really challenging to speculate, and I'm not going to speculate around numbers. it's our focus is on breaking what we call those chains of transmission. So trying to identify anybody, and this there's a number of case in point. The case from Iran is one. The fact that we had somebody, we've been doing surveillance in our community level, so all of the influenza tests in the lab are automatically tested for COVID-19. That's how we identified the healthcare worker and now the outbreak at the Lynn Valley Care Center. So our focus is on making sure that we can find people really quickly and break those chains of transmission so we don't have widespread transmission of the disease. And that means all of us have to do our part. And when I talk about social distancing, when I talk about having gatherings and not staying arm's length from people, not doing the handshaking, sharing of cups and things like that right now, that's how we stop transmission in our community, recognizing that we can't control everything that's coming in.
In order we got a very good briefing on Friday on the emergency plan and how much planning there is. In order to know when to move to the next phase of the plan, whether it's canceling elective surgery or getting retired doctors to come back into the system, you must need data. You must need a projection and know where we are. So you're not telling us where you are, or you haven't figured it out yet?
No, I'm telling you exactly where we are. We had 32 cases, and we have a number of people who are close contacts that we're following, but those numbers are small, and we are updating on those. Our strategy for understanding where we're going is around the testing that we're doing, but we are also doing modeling. And modeling to help us look at scenarios, and we talked a little bit about that when we announced the plan last week. So the BC CDC has been looking at the numbers that have happened in other places and helped us, so we're looking at scenario planning for a whole bunch of different things. So it's not going to be we're here today and we're there tomorrow. We are using some of those tools now. For example, we are asking some retired public health physicians to come back and work with us because we need to augment our public health capacity to do the contact tracing, to do the monitoring of people who are coming in. So we're taking some of these tools already that we have as part of our provincial plan, where the health authorities are looking at how we can set up assessment centers to ramp up testing if we need to, and we're starting to see the need to do some of that in some communities. So it's not a phase in terms of we're in one place now and we'll be the next place tomorrow. It's not going to happen across the province in the same way. So we'll be taking the measures that we need in the areas that we need as it arises.
It's over to Keith, and sorry, Linda. Keith first.
Okay, okay.
Sorry.
Dr. Henry, we've asked you this before about how you do if you think you're sick. So we had a woman call us, said she called 811, but was given no advice of what to do in terms. She wants to know, do I go to my doctor's office, emergency ward? So first of all, is 811, the people there fully knowledgeable about this in terms of dispensing advice? And secondly, if you could walk people through again what they should do.
Sure. Yeah, so 811 is our health link, so there's initial intake, there's also a nurse line that's associated with that. And yes, we update them very frequently. Over the weekend it was many times about exact situations, and so they have the algorithms to understand what people's risk is, and they walk through that risk with them. So for example, we knew there was a community exposure, community event that somebody was at, and the people in that event have been notified. They have the details, so they can actually say, no, it wasn't the event that you were at. So it's very hard sometimes to understand or to know what an individual person's interaction has been with 811, and they may not have received the advice that they wanted to hear, and that can be challenging too. So right now, we want everybody to stay home if you're sick. Even if you have the sniffles, you have a bit of a cold, your children are feeling a little bit under the weather, keep them home from school, keep yourself home from work if you're not feeling well. Even if you have no relationship to COVID-19, we want you to do that. And we want you to clean your hands regularly, we want you to cough in your sleeve. But those are important measures that all of us need to take right now. for people who have had specific exposures, or if you're at that point where you have shortness of breath and you have difficulty breathing, you need medical attention, then call ahead and tell people that you have a respiratory illness and you need to be seen. That way they can take the measures that are needed to protect everybody else in the healthcare setting as well.
And just on the 811 question, will be, it's a little in response to Vaughn's question as well. I believe we ordinarily get in the neighborhood of 1,100, 1,200 calls a week. That number of calls we're receiving has more than doubled, which is a real challenge. So it shows how we'll be building up capacity as well on that line. So people do have to be patient. We know that after each one of these briefings, we get more calls to the line. After each night on the nightly news, we get more calls on the line. So one of the areas that we'll be building supports will be around 811 in the coming days, and we'll be letting you know about that.
And long-term care homes, some homes are not allowing visitors, some are. Are you going to institute a uniform policy, and what should people do? Is it, even if you're not sick, don't go to a long-term care home?
No, I mean, long-term care homes are homes, and their residents who live there need the interaction with their family. But right now, we want people to be really, really careful. So it depends on where you are in the province, where the risk is higher. All long-term care homes should be making sure that they know what to do and have their plans in place, and they'll be working with the health authorities. I know they're doing that already. We want to have enhanced screening of visitors who are coming in and out of long-term care. So if you are going to visit someone, don't go as a large group. Go one by one. Only go to visit the person that you're there to see. If you have any concerns about respiratory illnesses, stay away. Or if you need to see, we know that many people in long-term care are elderly and that some of them are going to die from other reasons. And if you need to be with somebody and you're not feeling well, let the home know ahead of time so you can be given a mask, you can have appropriate things in place so that nobody else in the care home's put at risk.
And one last question. How long can the virus live on surfaces?
Yeah, that's one of the questions that we've been, the science has been looking at. It can live in, depending on the temperature and humidity, for several hours sometimes. That's why enhanced cleaning is really, really important. And so regular household cleaning products work very well against this virus. It's what we call an enveloped virus. So it is easily cleaned with using regular household cleaning products or a 1 in 10 bleach solution. But even if it's on surfaces, that's not how we get infected. We get infected by touching those surfaces, and again, it doesn't come, we don't get infected through our hands. We get infected because we inoculate ourselves. So that key step of, if you're on the bus and your hands are you're touching things that might have been contaminated, you need to clean your hands and be really careful and vigilant about not touching your face and eyes.
Over to Bender, then Mike, then Adrian, and back to Les.
I'm just wondering if you can update us on the community cases and if there's been a determination made about, I know with one of them there has, but I think there was another one last week where there was still an investigation being done about where this person contracted from.
So the only community case is the person who's the healthcare worker who's been linked back now to the Lynn Valley Care Center, and that outbreak investigation is ongoing, but it is becoming apparent that her source of infection was at work. Not that she brought it into the facility. So detailed investigation, it takes some time, but Vancouver Coastal is working really hard to try and connect those dots and figure out how it was introduced into the care home. The other person was our case who resides in Seattle, and I don't have an update on exactly where the contact was there, though she was in apparently in some facilities where there had been cases.
And with 4 new testing labs opening this week, is there any thought being given to doing sort of general testing, perhaps at care homes where seniors are most at risk?
Yeah, so there's no point in testing people who don't have symptoms, and so that's one of the things. We know the test is not valid in people who don't have any symptoms at all, although we do test some people if they've had close contact, and we know that particularly young people can be asymptomatic, so there's a bit of a judgment around the type of contact people have had. We are testing all of we routinely have a protocol for any influenza-like illness, we call it, in care homes, and we are testing all of those for COVID-19 as well as for influenza and RSV and the other routine respiratory viruses that are tested for. So the other 4 labs, they were open and they've been online as of last week. So 2 of them last week and 2 of them late last week.
And just wondering in terms of with this case that we've heard about at a school and renting out space, is that something that should not be done right now, perhaps? Is that sharing of that space at schools, I guess, especially? Or
again, in this case, there was nobody with symptoms who were in that space, so it's not a risk, and we put out the messages so people can be reassured. I think each of the schools has to look at how things are being used, and really important is to have those enhanced cleaning, and the schools have been doing this cleaning twice a day, and especially high-touch areas, and gyms would be an area that we'd want that. And then everybody else needs to take the measures of cleaning their hands and being really cautious about, and staying away if you're not feeling well.
Over to Mike, then Adrian, last.
There's a staff member at Sullivan Heights in Surrey who apparently tested positive. Fraser Health has put out a letter saying the risk is low, but parents are still worried. So how worried should those parents be? And the second question is key pass, never mind. So first question.
There was the letters were about people who had been in that school, and there's 2 schools that were asymptomatic. So there is no risk to the people in the schools that we know of, and that's what the letter is about. It's about reassuring parents that the school has taken all the measures to make sure that everything has been cleaned. They've enhanced the measures around cleaning and around students and helping students take the measures they need, like cleaning their hands regularly. And I think the teachers and the staff at both those schools and all the schools in the province actually are doing an excellent job on that.
Monsieur le ministre, je vous remercie. J'allais poser la même question en fait, Mike MacArthur, concernant cette école où un membre du personnel a été testé positif. Est-ce que les parents devraient être inquiets?
Non, mais on a informé tout le monde pour rassurer tout le monde de la situation. On va continuer à faire cela. C'est important d'apprendre des choses directement du NU ou de Fraser Health dans ce cas, ou du conseil scolaire, parce que nous avons les propres renseignements et nous allons les distribuer. Nous avons vu dans plusieurs cas des déclarations qui ne sont pas vraies, que ce soit sur l'Internet ou autre, mais la situation, on prend précaution parce qu'il faut prendre précaution, mais il n'y a pas de risque. Mais il faut informer des gens pour éviter que des gens prennent des mauvaises conclusions.
Concernant Lynn Valley, est-ce que ça veut dire que les centres comme celui-ci devraient limiter les visites, par exemple?
Ils sont en train de le faire, mais ce qui est important pour tout le monde, c'est que si on est malade, on n'y va pas. Hein? Dans quelques circonstances que ce soit, que des gens ne visitent pas les centres de soins quand ils sont malades. Et il faut dire la règle en général, mais c'est en particulier une règle maintenant de ne pas visiter si on est malade. Il y a des limitations si on choisit de visiter, et c'est important. Les gens, ceux qui résident là-bas, c'est chez eux, n'est-ce pas? Ils habitent là-bas. Donc, il faut qu'il y ait des visiteurs, bien entendu, mais de limiter des visites à votre propre famille ou amis, et de s'assurer avant d'y aller qu'on n'est pas malade. Sûrement.
Dr Henry a dit que selon les endroits de la province, il y avait des mesures différentes qui étaient appliquées. Est-ce que vous pourriez expliquer un petit peu?
Oui, la grande majorité de nos cas sont à Fraser Health et à Vancouver Coastal Health. Il y a un cas à Interior Health, 0 sur l'île de Vancouver, 0 au registre de santé du Nord. Donc, c'est une situation différente dans les différents endroits, mais les règles pour tout le monde, ce que nos conseils pour tout le monde sont les mêmes, n'est-ce pas? De laver des mains fréquemment, hein? De ne pas aller à l'école, de ne pas aller au travail, de ne pas aller visiter surtout des personnes de troisième âge si on est malade. Ces règles, c'est pour toute la province.
We're going to go to Les, Keith, and Vaughn, and then we'll go over to the phone. Les?
Doctor, if someone takes your advice to heart regarding social distancing, it's hard to square that with going to a hockey game or a theater or a nightclub. When do you get to the point of making recommendations about public gatherings?
Yeah, so we've made some recommendations, and it's all about risk, and it's all about where the setting is. Can people be far enough away from each other? You know, hockey games are very different from going to nightclubs, but we also don't have a lot of transmission in our community yet. So they have made different decisions in Seattle, for example, about some things. So each of them is really on a case-by-case basis, but we know this virus is transmitted by close contact, so within an arm's length of me. And it's when people inhale those droplets or with touching of surfaces and then self-inoculating. So in places like Hubei, for example, or parts of northern Italy where there was a lot of people sick, those environments become much more likely to be contaminated, and it's harder for people to remember to clean their hands and all those things. So the risk goes up of any sorts of gatherings. Right now, it's those close contact gatherings that we know people are transmitted. And even in China, most people who get sick from this get sick from their family and their friends, the people that they're spending time indoors with in close contact. So that's the biggest risk, and that's why right now we're focusing on those types of gatherings, like religious gatherings, like community gatherings indoors where people share food. Those are the types of settings where we have seen transmission and where we need to be most cautious right now.
Keith, then Vaughn, then over to the phone. Keith?
A number of care workers work in multiple long-term care homes. First of all, is that a concern? And secondly, what about the care workers in the Lynn Valley home right now? Are they in isolation, or how are they being treated?
Yeah, so we are very aware of that, and it's a challenge with our system, healthcare workers, and we know that whether it's care workers or nurses or even physicians, we work in many different health authorities, many different facilities sometimes. That is part of the ongoing investigation at the Lynn Valley Care Home to find out exactly where everybody worked and make sure that those other facilities are investigated and what's going on in those facilities. The people who had close contact with our additional case, so there's two healthcare workers from Lynn Valley who have tested positive, and their close contacts from work are at home on isolation, and that is a challenge. It's a challenge for staffing of the care facility as well, and Vancouver Coastal is working with all of the health sector to see how we can make sure that they have what they need for that care home.
And can you envision, follow up to Les's question, going from recommendations to actual orders under the Public Health Care Act?
If we need to. So we can take a lot of measures without having to formally write an order. We're not at the point where I would see us as ordering all public gatherings to stop, but we are watching that. That is something that might happen. It might happen if we get to a place where there are more cases popping up in the community that we can't link. And it's a way of keeping sick people away from well people until we can find those links and break those chains. So that's what they're doing in many communities in Washington State and around the U.S. We've seen it on a much broader scale in places like northern Italy right now. We're doing everything we can to not get there and to protect our communities, but also to protect our healthcare system so that we're effectively able to care for people with this virus, but also people who have all the other health things and health needs in our system. So that's why we've come up with the provincial plan, why we're broadening it so that we have all the tools we need, should we need them. Right now, we're still at the point where we have very few cases, sporadic cases popping up. We're linking them back. We're doing that contact tracing work, and we have continued importations, and all of them involve quite a lot of work to make sure we stop people from transmitting to others. And that's what we're going to continue to do as long as we possibly can.
Just what's going on in school? What are you recommending schools do? You talk about enhanced cleaning. Are all of them being ordered to do that, or just suggested?
No, they've been directed by their ministry. This was some weeks ago when we first had concerns about somebody who had been in a school. So this has gone out to all of the superintendents of schools around the province. I think the one thing that we're looking forward to is a little bit of a break with March break coming at the end of this week, and schools as a setting. I will also say that children have been relatively spared in this outbreak, and that's a really positive thing and a relief. We don't yet know the role that they play in transmitting infections to others. We know, for example, with influenza, young people can be very efficient transmitters without getting very sick themselves. Doesn't appear to be that type of a risk with this virus so far, but we are obviously watching that very carefully. So I think there's a lot of really good work being done in schools around the province.
And just to put it in context in terms of the numbers, right? We're announcing every Friday the number of tests we did. Last week we had more than doubled the previous period in that set of tests. So we did about 2,803 tests and about 2,008 individuals. And I think it's fair to say already this week, this is our most significant week ever, so we've done more than we had the previous week. We have created new capacity for that. And what we have are 32 positive cases amongst a testing group which had to meet the standard of the test, which is to have symptoms, to be symptomatic, and often travel history or linked to travel history. So that's the group of people we're testing, and to date we have 32 tests and 32 positive tests, and we have more. We'll be informing people every single day that happens.
Going to go back to Vaughan, and then we're going to go to the phone, beginning with Tom Zilich. Vaughan?
I spoke to someone who was in St. Paul's on the weekend, and she said she was in for a routine test. She said she went around the main floor, couldn't find the hand sanitizer that had any hand sanitizer in it. Apparently they're out or they haven't filled them. Which prompts the question, how well provisioned is the healthcare system with respirators, masks, and hand sanitizer? Is there plenty? Are we scrambling to find it? What is the state of affairs at the moment?
Yeah, so this is something we've been paying attention to for some time, and all of the health authorities, all of the facilities that we have, all of our healthcare facilities are stepping up, and it's not uncommon. We have heard of things being stolen, masks being taken away. We do have a pandemic stockpile that we have started to use. We have a process provincially for organizing that. We have a process nationally to make sure that we have the supplies that we need in the healthcare system, from the long-term care homes, community physicians, and hospitals. It's not perfect, and there's sometimes challenges in individual settings, but the message has certainly gone out, and we are purchasing with our colleagues across the country to make sure that we have what we need in the system.
How many cases before we're overwhelmed?
Well, there's a good question. The way that we're doing our scenario planning and what we have seen in other places is that it doesn't happen across the province at once. So we need contingency planning to make sure that we are able to support the areas that are having outbreaks. And so there's no magic number. I think we all know that our hospitals are working at 100 to 108%, particularly this time of year. And one of the reasons that we are being so adamant about breaking those chains of transmission and keeping as much as we can trying to prevent any transmission is because we are still at the end of influenza season. So we know that our hospital beds are fuller than they are at other times of the year. Having said that, all of the hospitals have plans for decanting. So less urgent people, finding temporary places for them in the community. We know there's people that are in our hospitals that don't need to be there for the care, but are there because there's no place for them to go. And there are provisions for being able to do that. There's also provisions for slowing down the people coming into the hospital, so whether it's delaying elective surgeries, things like that. So those are the plans that people are looking at. I think if we look at our numbers, we have 32 people. We have 3 people right now who are in hospital. And most people that we have had so far in BC have been able to be managed safely at home.
We're going to go over the phones now, starting with Tom Zilich, followed by Robin Gill.
Hello. Hello, it's Tom Zatarek, actually. Are you looking at some point recommending wholesale school closures or perhaps an early or extended spring break?
Those are definitely possibilities that we have in our toolkit. As I said, it's hard to know how effective school closures are for this particular infection. I know many other places are doing that as a way to keep people away from each other in what we know are congregated settings. There are other things that we can do to make schools safer during this type of an outbreak, things like separating kids in the classes, the enhanced hand hygiene and for children, the enhanced cleaning. But the challenge is, if we do close schools, making sure that children are able to continue with their education and that they're not congregating in other settings, which would be counterintuitive and wouldn't allow us to have not the control, but the supervision of children that we do have in schools. So these are all things that we consider. We're not at the point where we need that now. I will say that the fact that we have a 2-week March break coming up is a little bit of relief in that parents already have plans for what to do with the kids for those periods of time, and then we'll see where we are in the community cases that we have, and see where we are globally with the outbreak as this evolves.
We're going to go over to Robin Gill, followed by Camille Baines.
Dr. Henry, do you think that more residents of Lynn Valley could have this new coronavirus, and could it be a similar situation at other care homes and we may not realize it?
The investigation at Lynn Valley is ongoing, and I know there are other both healthcare workers and residents who have been tested. Some of them have tested negative, but there are other tests ongoing, and so I can't say, but I expect there likely would be one or more others in the coming days that we'll know more about. We are looking very carefully at all of the long-term care facility outbreaks that we've had, and retesting in some cases, looking at other care homes that are linked. And right now I don't have any indication that there is ongoing transmission of COVID-19 at any other care homes, but that's obviously something we're watching very carefully. We do have an ongoing process every year during influenza season that's very sensitive for checking for respiratory outbreaks in long-term care homes, and we're up to sorry, I didn't look at the numbers, but we've had over 100 again this year. So this is something that is not unusual for care homes. They know how to manage outbreaks and detect outbreaks. So all of the health authorities are working very carefully, and we're looking at that. I mean, it is very much a concern of ours.
We're going to go over to Camille Baines, followed by Jane Syed from North Shore News. Camille?
Hi, Dr. Henry. What details can you provide about this gentleman at the care home in terms of his age and whether he had any pre-existing chronic conditions or any kind of condition at all?
Yes, he was a man in his 80s, and he had a number of underlying health conditions, unfortunately. So in that risk group for people who are more likely to have severe disease with this. Having said that, I understand he was an active member of the community there, and he will be sorely missed.
Over to Jane and then Isabel Lamb.
Hi, it's Jane Side with the North Shore News. Just to follow up on that question, the other person who is ill at the Lynn Valley Care Center, can you give any details on them? Are they also in their 80s? Do they also have underlying health conditions? And what is their condition right now?
Sure. The other person who's tested positive, the other resident who's tested positive, is a woman in her 70s. Also, as many people do in long-term care homes, has some underlying conditions, but her condition is stable right now.
We're going to go to Isabel Lamb, then Cindy Harnett.
Go ahead, Isabel.
Oh, thank you. Hi, Dr. Henry. This question is for business procedures. So several food and beverage chains such as Starbucks, Second Cup, and Tim Hortons have temporarily stopped serving beverages in reusable mugs. Is this an appropriate safety measure, and are there any other changes that should be made to food and beverage procedures?
Yes, I saw that when I was in the Starbucks on the weekend. I'm not sure that it makes a difference, but I think it's one thing to avoid, I guess, contaminating with droplets, but the more important things are the washing your hands. As I mentioned earlier, we don't actually get sick ourselves from the droplets that are on surfaces or on our hands. We get sick when we inoculate ourselves with them in our eyes or our mouth or our nose. So the importance of hand washing can't be overemphasized, and that's the most important thing. And I think businesses need to look at how they can function should they have people who are sick with this or who are asked to self-isolate, and looking at ways that they can enhance social distancing from amongst their members or people that their employees. So we want to, there have been some companies who have already taken some measures, things around enhanced cleaning, and that's something that would be appropriate in places like Starbucks or other coffee shops or restaurants. Also, whether other businesses can look at reducing travel if there's non-essential, particularly international travel, foregoing that for the time being, looking at virtual meetings. Obviously, it's not for everybody, but making sure that that you can continue your business and have people work from home if that's possible. Things like that are measures that need to be looked at right now.
We're going to go to Cindy and then Anna from Reuters. Cindy?
Hello, Dr. Henry. Is there any explanation for the fact that there's been no cases on Vancouver Island? And secondly, is there any advice for religious leaders who are handing out, say, hosts and wine at Mass to hundreds of people?
Yeah, so the reason why we don't have cases on Vancouver Island, I don't know. We have had people who have been close contacts, and there have been returning travelers who've been monitored by public health, and thankfully no one yet has tested positive on Vancouver Island or in the north, although there have been people in all over British Columbia who have returned from cruises, for example, or returned from travel and have been in isolation. So it's not like we're not looking for it in those other places as well. In terms of the host passing the cup, now is the time that we need to take some precautions around that and putting it in people's hands, being careful about how you do it, not sharing the cup. Those are things that will be asking and have been talking to religious leaders about in the coming days.
Going to go over to Anna, then Bob Mackin and Andrea Wu.
Hi, Dr. Henry. What steps are being taken to protect vulnerable populations, so people like the homeless or people who are incarcerated? What steps are being taken to prevent them from becoming infected?
Yeah, these are obviously areas of concern. So far, we have not had issues because we've not had a lot of transmission in our communities. We've not had issues in our jails or correctional facilities. There is, as part of our all-of-government approach, we are now being able to reach out more systematically to those areas, and there are things that we do around prevention, around assessing people who are coming in and out of those centres that will be put in place. In terms of the homeless populations or people who are street entrenched, those are also plans we're looking at right now. We've connected with a number of the groups that support people in those communities and looking how we can, what measures are best to protect them. There's information that they need. Right now, they're not the at-risk group that we're seeing, but we want to be prepared should somebody have an exposure, for sure.
And if you look at the plan, that's a key part of what we expect. What we've seen so far, if you look at the cases as we've reviewed them here, is most of the cases, the majority of the cases, have been linked to international travel. And so in general, people who travel internationally are not a vulnerable population, although that's not always the case. We had one case of a couple in their 80s and an individual who tested positive, one in their 80s who's currently at Vancouver General Hospital. So what the situation is now and what it might be in the future are different, and certainly a huge part of the plan and the preparation that we presented on Friday and that we're working on now is to ensure that vulnerable populations are protected, most especially, of course, seniors and others in long-term care. There are approximately 29,000 seniors in publicly funded long-term care in BC, and they're obviously a central focus of this, as are people who are in acute care. But other vulnerable populations, and you saw it on Friday in the discussion of people with chronic diseases, people who are inadequately housed or homeless, etc., are obviously also vulnerable populations, people who have issues with addiction. So all of those are part of our planning going forward.
I'm going to go over to Bob Mack and then Andrea Wu, then Leanne Young.
Hi. Cruise ships are a major concern right now, but what about risks that are posed by commercial vessels, such as freighters in ports of Vancouver, Delta, and Prince Rupert, where crews often come ashore to visit the community after they dock? Are health authorities monitoring and testing the international crew members and also the local dock workers? And are there any quarantines or self-isolation right now on ships?
The short answer is to the first question is yes, and the second question is no. There is a very detailed process that has been in place for a long time around all of the ships that come into our facilities across the province, and it's involved with Transport Canada and the quarantine service at the Public Health Agency of Canada. So the mariner, the ship's captain, needs to fill out a form that gives an indication of all of the people on board each vessel, so whether they're crew or passengers, which is the case sometimes, and they have to give 96-hour and 24-hour ahead of arriving in port notification about the health conditions of all crew members. And if there's any concern about respiratory illness, then the quarantine service and CBSA are part of the team that go on board the ship to investigate. They do a lot of it remotely before the ship comes into port. So there is a well-established process for that has been updated to ensure that we have notification around anybody who has respiratory illness that could be related to COVID-19. There's a detailed history of where the ship has been, and as you can imagine, it's often way more than 14 days that they've been at sea prior to coming in here. So the risk overall from ships in our ports is very, very low. There's small numbers of crew in most of these ships, and the type of work that is done on the docks, where it's mostly outside, where there's very little face-to-face contact, is not a risky, not as risky an environment that we would be as concerned about. We do know this process is working. We have received notifications, as we have over the years, for a variety of different things, from leprosy to tuberculosis to many other conditions that people may have on board these ships. And we've had a number of investigations in the last few weeks since this started that people had concerns that crew members had respiratory illnesses. None of them have been related to COVID-19. And we've been working with the port authorities and with CBSA and Transport Canada to make sure that those processes remain and continue to be robust.
We still have a few people on the phone. We'll go to Andrea Wu, Leah and Young, and back to Jane Syed.
Hi, Dr. Henry. Do we know yet whether either of the healthcare workers had worked in other facilities in recent weeks?
Yes, we do know that the initial healthcare worker has worked at a number of, two, I believe, other facilities, and there is investigation obviously ongoing in those facilities to determine exactly who had contact with whom, whether she worked when she was ill or not, and that's part of the investigation that's ongoing now.
Over to Leah and Young, Jane Syed, Penny Daflos.
Hi, Thanks, Dr. Henry. So I just was hoping you could clarify the number of active cases that we have right now. So you said 32 cases. Is that in total that we've tested positive from since the beginning? And were there actually any new cases that you've determined from Lynn Valley Care Center today? Or is it just the two that we already knew about, plus the additional?
So 32 is the total number of positives we've had, and 4 of those people are considered fully recovered and have had negative tests, but that's 4 of the 32. There are no new positive residents that have been identified from the Lynn Valley Care Center, so just the 2 people who we identified on Saturday, and one of those people was the man who died last night. There has been 1 additional healthcare worker that's been identified from the Lynn Valley Care Center. So we now have 2 residents who've tested positive and 2 of the healthcare workers.
I'm going to go back to Jane, then Penny, then Cindy, and we'll close with Wayne Wee at Toronto Star. Jane?
Hello, Dr. Henry. It's Jane Syed again from the North Shore News. Back to the Lynn Valley Care Center. I'm a little bit confused. Is it possible, do you know at this point whether the original community care case, the worker in her 50s, whether she could have actually contracted it from the other worker that you're now identifying who was in her 40s, or did they both possibly contract that from somebody else? What can you say about your investigations?
So the investigation so far has not determined that for sure, but what we do know is that very likely that both healthcare workers and both residents that we know of now were infected from someone else within that setting. And the investigation is going on to determine exactly who and how that happened.
I'm going to go to Penny Daflos, Cindy Harnett, and close with Wan Wei Lee from Toronto Star. Penny?
Hi there. Thank you for taking my question. It's just around the level of care for the people who are currently at the Lynn Valley Care Center. I understand that there may be difficulties getting people in there to actually work and care for the residents. What can you tell us about the level of care for the people who are still in there and the help that they're getting?
I think, and Dr. Henry will respond as well in a second, the medical officer of health who's there is Dr. Mark Lasician, who's in charge of our investigation and the work of Vancouver Coastal Health is there. Dr. Patty Daly is also involved and has been directly involved on site. So there are obviously going to be challenges in a care home facing this kind of thing, and so Vancouver Coastal Health is working very heavily both to recruit more support for people in the care home and to ensure that those issues are addressed. But it's a real challenge for the workers in the care home right now, and there are challenges that people are are prepared for in their training, but also when it happens in this way, present real challenges. So Vancouver Coastal Health and the health system is mobilizing today, certainly, and has been over the weekend to support the Lynn Valley Care Centre.
I'll just say that, managing and caring for people during an outbreak, particularly of an outbreak of a new disease where there's still very much an element of fear for a lot of people, is a challenging situation at the best of times. And with some of the staff being sick themselves and others being isolated at home in quarantine because of close contacts, it's a very difficult situation for all of them. But I will say, our care aides, our nurses, the physicians who are supporting them, are really going to great lengths to make sure that all of the residents in that facility are cared for and get what they need. And it's kudos to them, and particularly, I want to really support the care aides and the nurses who are doing such a tremendous job caring for people, even though there's so much concern and sometimes fear around this virus. So we're supporting them as best we can.
Over to Cindy Harnett.
Hi, would you mind, could you please just reiterate briefly the plan for hospital beds if and when we have a high number of seniors from the community or immune-compromised people needing hospital beds? And just as a follow on Penny's question there, if it's not too much of a bother, can you just go over the origin of those 32 cases in any way that makes sense one more time?
Sure, we can do that. Each health authority is established some time ago. We established our, approximately 7 weeks ago now, our emergency response team on this issue that has been led and co-chaired by Dr. Bonnie Henry and Stephen Brown, who's the Deputy Minister of Health, who has worked extraordinarily hard on this question. Each health authority has established its own emergency operations center that's functioning, that is responsible within the health authority for directing resources where they need to go. A lot of those resources are required in the community. To date, the vast majority of cases, only 3 of the cases are in acute care. So the vast majority of demand is in the community to ensure that we're applying the resources where they need to be applied. And so that work is happening every day as the situation evolves and will continue to occur. On top of that, there are all the other parts of government that will be applying resources to this. But that has been the organization that the health authorities put into place. As Dr. Henry has said, we only have to date 3 cases in acute care. One, as we've discussed, at Vancouver General Hospital, and the other 2 in the Fraser Health Authority. So those are the 3 cases that we have. So the acute care pressure is not there yet, but we're obviously preparing for that. But also we need to apply appropriate resources in the community, and the situation at Lynn Valley and others demonstrates the need to do that.
Yeah, I agree. I think, and the plans are, they're fluid, but we have done this before when we've needed to, during the pandemic in 2009, to be able to, what we call, decant people out of the facility if needed. So it'll be done on a case-by-case basis, depending on what's happening in the community. So each of the health authorities is looking at each of their hospitals and determining which is the best one to do. We obviously want to take into account other considerations, like, is it the major trauma hospital, and how do we make sure that we are able to provide those major trauma services, so that it may be that most people who need hospital care can be done in another facility. So all of those considerations are being done at a regional basis and discussed provincially as well. In terms of the cases that we've had, all of them have either been imported cases or transmission within a household, with the exception of our one case, we called her case 21, which is the person who works in the Lynn Valley Care Centre. And the imported cases, half of them, 16, have been associated with somebody who's traveled back from Iran and sometimes spread within a household, but linked back to travel to Iran. 5 of them have been linked back to travel to China, 6 if you include Hong Kong in there. And then we've also had one person who resides in Seattle and whose contact and source of infection was likely in Seattle.
We have 3 more questions on the phone. Juan Wei Lee, Toronto Star, Jane Syed again, and we'll close with Leanne Young.
And of course, I forgot to mention, but we have had people who've come back from being on a cruise as well, and 2 of them have tested positive.
Hi, Dr. Henry. Do you know if the care workers at Lynn Valley Center are wearing N95 masks or other protective equipment? And also I'm wondering, how many sick days do care workers at the center get?
So people at the care center and in all of our healthcare facilities are wearing the appropriate PPE for dealing with droplet transmitted infections, and there's a whole variety of things that are that come into play around what is the appropriate PPE. So for most care for people with COVID-19, that includes gloves, a mask, a surgical mask, eye protection, very important for droplet spread infections, hand hygiene, and a whole raft of things that go with that. So at the care home, they'll be wearing the appropriate PPE for that care that they're provided there. I'm sorry, the second question was?
The sick leaves?
The care workers
sick leave, yeah. I think when we take public health actions and we ask people to be away from work for the protection of the public, and where we ask people to be in quarantine for protection of the public, we are looking at the measures that can support them to be able to do that effectively, regardless of the sick time.
And that will be one of the issues that we have in our discussions with the federal government as well. We may remember, for example, in 2003 and in other natural disasters since then, the federal government has changed some rules with respect to access to unemployment insurance, for example, and those are issues that we'll be working on with them.
Final 2 questions to Jane Syed and then Leanne Young. Leanne Young then? Okay. Any final questions? Oh, go ahead.
Hi, Dr. Henry. So thank you again. So do you know how quickly from when this gentleman in his 80s that died, when he developed symptoms to when he passed away, and what the average turnaround time we're looking at right now is for testing?
I don't actually have the details of that. I know his symptoms were detected in the investigation that occurred on late Thursday, early Friday, and the turnaround time for the tests that are coming from that facility and from most of the concerning cases that we have is less than 24 hours.
I think that's it on the phone. Any further questions here in Victoria? Okay. Thank you, everybody. Thank you.